Okay, Courtney, we're going to continue with the neurological assessment. We're going to check your 12 cranial nerves. Cranial nerve 1 is the olfactory. This is not usually tested unless a patient complains. And this is tested by taking a familiar object and you closing one nostril at a time. And then you're going to close your eyes and let me know what you smell.
Coffee.
Yes. Okay, so cranial nerve number 2 is the optic nerve. I'm going to have you stand up and we're going to do the confrontation test. So cover your left eye. Wait, this one. Okay. And then you tell me whenever you see my wiggly finger.
No. No. No.
Okay, and that was just to test your peripheral vision. Okay, you can have a seat. Cranial nerve 3 is the oculomotor, 4 is the trochlear, and then 6 is the abducens. So this we're going to check Perla and the 6 cardinal views, the field, whatever. Okay. All right, so your pupils, they are round and they are equal. I'm going to shine this in to both eyes and they constrict. Okay, and then we're going to test accommodation. So I'm going to have you look out there at an object and then to my finger. Good job. All right, so now I'm going to have you follow my pen light. Good. All right. Cranial nerve 5 is the trigeminal, so I'm going to have you clench your teeth and move your jaw side to side. Good. Cranial nerve 7 is the facial, so I'm going to have you smile, puff out your cheeks, frown, raise your eyebrows. Okay, close your eyes really tight and try to, okay. All right, so cranial nerve 8 is the acoustic, so I'm going to come behind you and we're going to do the whisper test. So I'm going to have you close your left ear. And tell me what I say.
ABC.
Okay, and then I would do the same thing on the other side. All right, so now we're going to do the Weber test. So I'm going to strike my tuning fork, place it on your head, and tell me when can you hear equally on both sides? Okay, so we're going to do the Rhine test. I'm going to strike my tuning fork, place it on the mastoid process. Tell me when you stop hearing it.
No.
Okay, and tell me when you stop hearing it.
No.
Okay, so air conduction should be greater than bone conduction. Cranial nerve 9 is glossopharyngeal, and 10 is the vagus. So I'm going to have you swallow, stick out your tongue, and say ah. Okay, your uvula and soft palate should be midline, which they are. Cranial nerve 11 is the spinal accessory. So I'm going to have you push, and then shrug your shoulders. Good. They should be equal bilaterally. And then cranial nerve 12 is the hypoglossal cranial nerve. I'm going to have you stick out your tongue, and it should be midline with no tremors. So that's good. I'm going to have you say light, tight, and dynamite.
Light, tight, dynamite.
Okay. So now I'm going to check your deep tendon reflexes. And check your biceps first. All right. I'm going to strike right below my thumb. And you should see flexion. Okay, and then I'm going to check your triceps. So, dangle it. Okay. You should see extension. Now I'm going to check your brachioradialis. Okay. That should be flexion as well. Now I'm going to check your quadriceps or your patella or whatever. And then, okay. Flexion. Good job. Now I'm going to have you rotate your hip and then, okay, I'm going to strike it. There we go. Okay, that's salt.